health news now. Strokes can happen to anyone at any age. In fact, 1 in 4 people worldwide is going to have a stroke at some point in their lives. So today, on World Stroke Day, I want to take a closer look at how to know if someone you know is having a stroke, and also how to prevent one. I'm joined this morning by Dr. Matthew Fiesta, an interventional neuroradiologist at Texas Health Fort Worth. Thanks so much for being here with me today.
Thank you for having me. I really appreciate the time here today.
So first off, can we just talk about what happens in the body when you have a stroke?
When you have a stroke, the blood carrying the oxygen to the brain doesn't reach the brain. And that happens most commonly because a clot from somewhere in the body goes up to the brain vessel and blocks that blood from reaching those brain cells. So then they die from lack of oxygen.
And Dr. Fiesta, is this an immediate thing that happens in the body, or is it a process that sort of happens over time?
That's a great question. It is not immediate, it is a process. So that's why it's very important to stress to go to the hospital and call 911 as soon as possible. There's a common saying that time is brain, and the faster you get treatment, the better chance you have of a good neurological outcome. I also want to stress here that if you have a symptom that comes and goes, or you see someone have a symptom that totally resolves, don't ignore that symptom. That is probably a warning sign for a bigger stroke to come. Don't call your friends and family first. Definitely don't try to sleep it off. It's very important that you immediately call 911 and go to the hospital.
Yeah, I think that's certainly great advice. Who is most at risk here? I mean, I know I've said a lot over the last 6 years since I've been the health reporter here that really this can happen to anyone at any time, but I'm wondering if there's a trend that you've noticed more recently. Is it men? Is it women? Is there an age range?
It's important to know that a stroke can happen to really anybody, any age, men or women. Definitely, we see it more commonly in the elderly, but I've definitely treated several patients that were teenagers, 20s, 30s, every decade. So just because you're a younger individual, do not think that you can avoid or won't have a stroke. It's definitely important to realize you can, and don't ignore the symptoms.
Why don't we talk about some of those warning signs, just in case people are unaware, maybe they've forgotten?
That's great. So the American Heart Association likes to stress this acronym of FAST here. So start with F for facial drooping. So you look at somebody, one side of their face is sagging. You may try to make them smile, and it's not symmetrical. One side continues to drag. Then look at A for arm weakness. And so basically they can have one side of their body completely paralyzed with zero movement, or they can maybe lift their arm, but then it kind of droops downward. So you can have them try to lift their arms up and keep them up. Then you have S for speech difficulty, and that can come in different forms. One form is they're trying to say words and they can speak some words, but it's kind of slurred. Another possibility is that they can't even find words to speak or understand language at all. And then lastly, and very important again, is T for time to call 911. Again, time is brain, and you need to act on that right away. And also important to think about is try to record the time. That way when you go to the hospital, be able to tell the doctors, hey, they were last seen normal at this time. It really helps us in treating the patient, knowing that information.
I haven't heard that, so that's really helpful. Finally, 1 in 4 people, that is a lot. So what can each of us do today to reduce our risk for stroke?
One of the biggest factors is blood pressure control. If you have elevated blood pressure, it's super important to get it under control, go to your primary care doctor, get on medications if needed. That is one of the biggest factors that causes strokes. Also important is to reduce stress in your life. That can go hand in hand with high blood pressure. And also just try to be as healthy as you can, have a healthy diet. If you smoke cigarettes, definitely stop smoking, and try to exercise. And these are all things you can do to hopefully reduce your other health risks throughout your life. And also serves as a great example for others to see you do that, and hopefully they'll catch on.
Okay, Dr. Fiesta, thank you for helping us to spread a little awareness on this World Stroke Day. And for those of you at home, to learn more about strokes and the warning signs, you can go to stroke.org/warning signs.